Hello, my name is Edward Morrison. My friends call me Chip, and I hope that I can call you all friends by the end of this week, if not by the end of the semester. Um, I began the DNP program. Right now, I'm non-matriculating. I'm applied to be admitted in the fall of 2016. This is the second class I've taken online, and so far, I really like CU, and I think the program will fit my needs quite nicely. To the second point, what do you hope to accomplish this semester? And nursing theory has always been my favorite topic to study in nursing. And the most interesting part to me is how disjoint nursing theory can be to day-to-day nursing practice, or in my case, advanced nursing practice. So it's interesting as I try to find a way to integrate theory with practice. And I really think that's part of the reason we're all studying as hard as we are to get to this terminal degree, as we're trying to get a more comprehensive understanding of this profession that we've chosen. And so with that in mind, I do think that the how and the why of nursing practice as it relates to theory is as important as the hands-on part that we do. To the third point, how does the study of nursing theory relate to the DNP? Well, I mean, as I mentioned, this is a terminal program. Once you become a doctor of nursing practice, you're pretty much queued up at that point to hand off the profession through education and research to the next generation. And so with that in mind, I think that theory has an integral part in that. Although DNP is a practice degree, I think that practice degree is directly related or directly connected, if you will, to the grand, mid, and practice level nursing theories that have been established for us. Um, the next point, what makes advanced nursing practice? I'm an advanced practice nurse. I've been doing this at this level for about 4 years, and I always find it interesting that as advanced practice nurses, we get lumped in with physician's assistants or with physicians, and we're called providers. And although we do the job of a provider, you know, in my heart, or in the way that I define myself, I view myself as a nurse. And so I find that a lot of our job as mid-level providers that have a passion for nursing is to educate our coworkers and our patients and the community that our view of medicine is very different than that of a doctor. Certainly not better or worse, but it's all part of a more comprehensive healthcare package. And I think that there's things that that NPs bring to the table that advanced practice nurses have through their training and experience that physicians or physician's assistants don't have. I believe the converse to be true as well. But I don't think that in any way, you know, becoming an advanced practice nurse separates you from nursing. If anything, it helps you be more holistic in your care. The final point, which grand, middle range, or practice theories am I interested in exploring in greater depth? Um, I believe that Newman's theory, the stress-related theory, is really fascinating to me. And right now, my profession is centered around the chronic disease of heart disease. Uh, I think that Newman has a really interesting way of um, of integrating the the grander human situation. It's not an illness-based theory; it's a holistic theory, and I think that it really helps me to focus on the fact that maybe um, what we're treating is not illness. What we're treating uh, is a condition of a condition of health that is not ideal for the patient. We're all in different states of illness. I know that I'm in a different state of illness than I was 20 years ago. And so when I deal with people that have this chronic disease of heart disease, I see how it impacts or affects their life, and how the illness itself can be the source of stress, and conversely, the stress can be the source of the illness. So for me, I think that Newman's theory on the grand scale is one that I'm interested in exploring more. In summation, I'm just really excited to be a part of this class, and I'm looking forward to working with each of you. I think the project base is going to be a learning experience for me for sure, and I look forward to getting to know all of you better.